What I want to talk about today is culture and culture change. I'm Jeffrey Braithwaite, Professor of Health Systems Research at Macquarie University. So I do research in the health system, and when I and my team move into the health system and do research in community health settings or public health units or hospitals or aged care facilities, we often hear people talking about culture. Got to change the culture. Got to have a good culture by which to deliver care to patients. And I often wonder what people mean by that and what they think they mean by that. We know what's behind this. What people would like to do is create and work in effective, productive, supportive, dynamic cultures that deliver good care to patients. But what is that? That's a definition, but what does that actually mean? Think about it this way. Imagine an iceberg, and above the iceberg are the behaviours and the practices of the people in the organisation. Below the waterline are the mental construct stuff, the stuff you can't easily observe the way you can with behaviours and practices. It's the ideologies, it's the beliefs, attitudes, values, the perspectives of people. It's the stuff in individuals' heads which they transmit to other people in the organisation or the setting, which creates a mindset, a collective mindset. That's culture, and it operates at both those levels, the observable behaviour and practices, and the below the level of observation, the attitudes and values and beliefs and perspectives and ideologies. So we've done some research recently where we looked at the literature on culture, trying to figure out the answer to this question, and I bet anybody watching this has a view on it. If you have a good culture, productive, interactive, people are nurturing and supportive of each other, you would deliver better patient outcomes to patients who you're delivering care to. I guess you believe that, and I believe that. But is it true? So we looked at the literature systematically, looked at 62 studies that we found in PubMed, the medical database. And we looked at wherever there was a study of culture and it was related to outcomes, what direction those two constructs, those two variables were. And the answer was, as you've suspected. Stacking up the 62 studies, almost all of them said, if you have a better culture, you will deliver better outcomes to patients. So this demonstrated what we thought we knew in a very systematic way. But that's not the end of the story, is it? Because now people have to do something with that, not just me writing a study with my team and publishing it in the literature. So what do we do with that knowledge? Well, there's some things we know about trying to make for a better culture, to improve things. One is work with both the attitudes and values of people and try and shift them in a positive direction, as well as the practices and behaviours of people. Another one is really harnessing the good people. In all cultures, even if they're not as good as better cultures, there will be some good aspects to it. So harness the good people, harness the good aspects of a culture. A final piece of advice though, and one really on the minds of many people across the world these days. It's better to recruit good people into the culture in the first place. My advice, recruit good people and try and keep the psychopaths out.